raise your hand. Your favorite trip was to Peru to see Machu Picchu. Erin likes to downhill ski. And she has 2 dogs, Bodie and Tux, and Bodie's a therapy dog and Kirby's cocktail. You should come in some. Alright, Samantha, where are you? Fun facts about Samantha. In school, she was soccer and dance. She likes to spend time outdoors with her animals. And her favorite vacation was Mexico. Very cool. Welcome, Samantha. So now our office staff. Andrea, where are you? You're in the back over there. Some fun facts about Andrea. In school, she was, yes, in school she was in basketball and track. She is engaged to be married in August of 2015. Congratulations. And she used to be a 911 dispatcher. Very calm. Tony. Is Tony in the audience? Is he driving? He might be driving. He's our new service specialist. Some fun facts about Tony. He likes gold. He's also engaged. And before PHS, he was a firefighter.
All right, sweet pickle time. Sweet pickle time. So I want to thank everybody who submitted a sweet pickle this past month. We had 23 submissions, which is definitely up to the top of range of our submissions. So thank you, everyone. Keep them coming. We love them. This sweet pickle was submitted from Jim Romer. So thank you, Jim. I don't know if Jim's here today. The sweet pickle goes to Matt Bacon and Matt Snyder. Our IT guys, so single Matt, single T, and double T as I call them. So Jim wrote, Matt and Matt, I very much appreciate your help on a Saturday afternoon getting the Granny printer to work. We were able to provide the necessary documents to our TPN customer at Gillette Pharmacy. Thank you very much. So congratulations, Matt and Matt. And while I've got the floor, one quick other announcement is patient satisfaction survey. We drew our quarterly patient satisfaction survey this month. As you know, we do that every quarter. And the winner is Anthony Hill's mother, Shannon Hills. So she submitted a satisfaction survey, so she will be getting a $100 gift certificate. So, awesome.
So this actually is a great follow-up to both Sweet Pickle and our patient satisfaction surveys. You know, one of the hallmarks of PHS is our customer service and really delivering great customer service. So this next video clip is just a great reminder for us how to deliver that great customer service. As you're watching it, just look for the attitude, the spirit that this girl has. She's one of the front desk people from Four Seasons, and it's her example of how they deliver good customer service. Let it roll.
Okay, tell me your name and what department you work in.
My name is Nicole Newman and I work in the front desk.
Nicole, recently you were involved in a wow experience at the hotel. Can you shed some light on what was going on and why we think it's a true wow here?
A guest came to check out. He was in a rush. It was 4 in the morning. He had to get to his flight. He ended up locking his keys and his luggage in his rental car. Tried to, shimmy it open few different ways, couldn't get it open, decided he was going to miss his flight, took off to the airport in a taxi, and kind of gave up on it, asked us to mail him his luggage as soon as we got AAA then for to get to his car.
Okay, so what's next?
So after he left for the airport, we called the rental car company. We convinced them to get OnStar to remotely open his car. They opened it for us. We grabbed the bags out of the car, called the guest, let him know we were on our way. We were going to take his luggage straight to him at his airlines. So, you know, he was kind of flabbergasted, didn't really realize that if we had tried a little harder, he could have done it while he was with us. But I got in my car, drove to the airport, was there within 15 minutes, and got him right at the gate, and he boarded his flight perfectly on time.
And what was the guest's reaction when you showed up in your own car to give him his luggage?
He was pretty impressed. He wasn't expecting that in the least. He was, you know, prepared to pay a hefty fee to have his bags shipped across country and just move on with his day. But he kind of was a little bit humbled to see that we went the extra step to get his stuff.
Did that inspire you to hopefully do some more wow things for guests in the future?
Of course. It's such a good feeling to know that, you know, it took not as much effort as you might think on my end to make one phone call and then jump in my car and drive 15 minutes, and it truly made a difference in his stay and his experience at the Four Seasons.
I'm going to put you on the spot and ask you one last question. Your favorite part about working for Four Seasons Boston?
It would be the interaction with the front desk. You know, I love seeing who comes in, people that are return guests. It's so wonderful to see them again. You know, first-time guests, all the kids that come in, we have a teddy bear tree for Christmas, and their eyes kind of light up when we come around with our toy cart. It's just everything good about it.
Thank you so much, McCall.
Welcome.
So, you know, one of the things I noticed about that is that uncontainable smile. It was almost like she's trying to hold it back. I think it says something about the heart in which she gives the customer service. That's the kind of customer service we want, and I think expect. And even more, I think we want that heart, that same heart that delivers that customer service. And I think there's benefits you can see. It gives her joy. Obviously, it has a huge impact on the customers. And you know what? I think we've got that same kind of customer service here. In fact, I had Jody pull just recently some of the email comments that we get sent around that speaks to the kind of customer service that we deliver. The first one I have is coming from Carletta, where I'll just read a couple of phrases. The HCN department saved my sister. She doesn't know what it means to have the nurses that we have in their home. Lindsay Padich sent one, and the last phrase was, PHS is amazing. You guys really are. You are best in breed. Well, maybe we don't want to be a breed, but you get the Steve Morley sent one, a couple of phrases out of his. We love PHS, and you always take care of everything we need. Somebody was willing to go halfway to St. Cloud on Saturday. It's easy. It's always stress-free. I have 1 minute remaining. I'll be honest. Josh sent one, and it was just simple. We're very pleased with the new supply form. Mark, your last comments from the corner office, one of the quotes maybe that you didn't catch, your pharmacy can do no wrong. They are fantastic. I mean, these are the kinds of things we see repeatedly come through. You guys are doing a great job. We just want to keep instilling. That's the customer service we want. That's what our customers expect. So let's just keep doing it. All right, next up, we've got that special announcement.
Why didn't we go all the way to St. Cloud? It's a joke. You want me to use this? Yes, okay. Woo, who poured the vodka in those glasses? Let me tell you. All right. As you guys noticed, we do have a Bloody Mary bar, and that is for a special person that's been in this organization for 20 years. I don't know if you can believe that, but 20 years. I remember when it was her 10 year and I went, wow, that's really long. And now another 10 years went by and it's like, holy cow. But so, as you guys probably realize, it's Cameo Zender's 20th year employed at PHS. So I'm going to just kind of give a lot of you that are new, well, even some that have maybe been here a few years, probably don't know the whole path Cameo took to get to being PHS's in-house counsel, which I think is probably one of the coolest stories around, especially in business. So we're just going to tell the story. For those of you that know, sorry you're going to have to listen to it, but the folks that don't, it's really cool. So Cameo started working here at PHS back in 1994. Some of you probably weren't even alive at that time. But we got a lot of young people working here. See, like, we got a 20-year-old working here. Who is that? Raise their hand. Oh, Lena, right there. Lena was Cameo was here longer than you were alive. So the really cool thing is Cameo started here as a filing clerk for us. And I have stories from folks that have been here for a long time that she used to wear shorts and a t-shirt and a baseball cap on backwards. And, you know, she'd come in and just, be pulling files, putting delivery tickets in patients' files and all that sort of thing. Well, the reason why she got a job here is her mom worked for a temp agency, right, Cameo? And then you were looking for kind of just some part-time work. And your mom, I think we owe your mom like a huge ton of gratitude. She placed you here at PHS. So that's how it all started. And then, I'm sorry. So yeah, she started when she was 9 years old. She was just 29. There's that old joke. I can say that because I am just like 3 days older than you. 3 days. So I think in Cameo, because I couldn't ask you all the specific details about the PowerPoint here, so correct me if I'm wrong, but were you going to school at the university while you were working here?
Correct.
So she went to the school at the university, got a communications degree. What did I say? Okay. Here she is. Got it. We had to do one little embarrassment. So, yeah, she's 10 years old there. So, in 1995, she became a customer service rep. And there are kids here, so I can't explain the entire story, but for those of you that know what a percussor does, it kind of vibrates and it loosens secretions for kids that can't do that. There's another word for, starts with a V, ends with an R. I'm just going to leave it at that. You guys, if you have questions, come and ask me. And then she went on in 1997, now to be our PHS sales rep for a while. So one of the stories I've heard claim to fame is Cameo could carry 12 nebs on each arm. And I want you guys to see what this would look like. So we're gonna Jody's coming up. Oh, and she was pregnant with that one right next to her. So, yeah, Cameo used to walk around and deliver nebs.
I know I'm wearing more than my body weight right now.
So Jody was nice enough, we thought we got to get someone kind of Cameo size that just really, show the effect of how many 24 nebs look like.
I don't even know if this is 24 and I'm...
It's a lot of nebs, you guys. I used to do it too, and I don't know how I couldn't do that. So, very impressive. Not only did she do that, Cameo went out and brought on new sales for the company, groomed a lot of the big relationships that we have on. So, kudos to her for really helping us start the sales piece. And then back in 2000, Cameo became the customer service manager. And I'm telling you, I worked as a patient service rep and Cameo was my manager. One of the best managers I've ever had. She was just able to really help me, help the patient, really be able to support all the customer service reps. I remember she always had a line outside her door of people going, I got this question, I got that question. It was crazy. But I do have a quick story. This is something that there's kind of a little known thing about a nebulizer being sent to France. So when Dexter first started working at PHS, he's been in customer service since he's been here almost like 14 years. Dexter came, I don't know if Dexter's here, but Dexter came from, oh there he is. Dexter came from an organization that they used to do a lot of international shipping. So Dexter, as we are wont to do, take care of the customer, take care of the customer, take care of the customer, take care of the customer. We drive that into you guys, take care of the kid. Dexter got a call from a dad who was in France, who they put the nebulizer in one of the, the European outlets, and it blew the nebulizer up. So Dexter got that call, we needed to ship a nebulizer, so Dexter said, I gotta take care of the kid. So, yep, no problem, shipped it to France. Well, it doesn't quite get to France, it sits in customs for months. And so there was a lot of back and forth on, well, you haven't gotten this neb, so I know Susan and Judy and Cameo got talking to this family. There was telegrams or telegraphs or something going on. Something along those lines. And not only that, but this family was traveling, so they weren't ever just at a destination. They were driving, throughout Europe and all that. So it wasn't like we could pinpoint exactly where. I think we shipped 3 different nebs to this family in France or in Europe or something like that. Never got to them. But Dexter did tell me that he never did get fired for that. He remembered the day specifically because that was the day he closed on his house, and he still lives in that house, and he thought, I don't know if I'll sell this something because I'll make a fire. This is just a picture of Cameo. I think this was some of your last days as a customer service manager, so as you can tell, most people are still here. And then, I don't know, there's also this story that I'm trying to remember about something along the lines of a veil bed. Do you guys know what a veil bed is? I don't, I'm sure Anthony does, because he probably helped try to get this veil bed, but I think, Mom, you've got a story to mention about a veil bed.
We have a theory here, and I think you've all heard us say it, is when you hang up the phone and you're taking care of the child, you've done your job. So Cameo got a call for a child who had Rocky Mountain spotted fever. And unfortunately, that sounds kind of like a funny disease, but it's definitely not. The child had constant seizures. And so they would shake and they would hit themselves in their bed, and the child was bruised and contused, and so we needed to do something for it. And so Cameo said, well, we'll just look up what would be the best thing, and she came up with a veil bed. I believe she took that order in about 2001. In 2004, we got paid for the veil bed. And not to put any salt in this wound, $2 more than we paid for. It does bring up this statement. Mark started the conversation out today by telling you all customer service is extremely important. And it is. It is the most important thing. And so I don't have a Bloody Mary, but Cameo, the best customer service kid I've ever met.
That's a picture of a veil bed for you guys. I think they banned them. And that's it. We'll be done. Then no more conversations with veil beds. I promise.
I won't.
Okay. So then, in 2004, we had an imposter running around the office. Hang on, I gotta find him. Where the hell is he? Sorry, Derek. Blame it on Murph. He helped. This was at Cameo's 10 year, and we had Derek put on the wig, pretending like he was Cameo, and we were coming up doing weird things. But there is only one Cameo. Let me just mention that. So, in 2007, Cameo, Chris Garrity, for those that don't know, retired. For those of you that don't know him, too much vodka in that bloody he was one of the original six, along with Susan and Bruce and Sandy and Kay and Colleen, helped start this company. Chris retired. He was our regulatory affairs manager, and he retired. And Susan said, I need someone to replace him. Who better to do that than Cameo? And I remember my mom was really impressed that she asked Cameo, and Cameo said, let me think about it. And then, I don't know, it was maybe thought about it overnight or a couple days, and then she wrote Susan a post-it note and said, I accept, and put it on her desk. That's pretty cool. So she took over for Chris back in 2007. Here's just some of her folks here. We tried to get as recent in this picture as possible, but we weren't able to get out everybody that's in there now. So, and then after that, and I don't remember the date, it was probably 2008, Cameo became a member of the senior team. Skills, knowledge, compassion, dedication to this organization, she needed to be a part of that senior team. So we put her onto the senior team, and she's just been fantastic ever since. Not only that, as we grew, we knew we needed somebody with legal background, and not just being a lawyer, but with healthcare experience. And so we asked Cameo to go to college and become PHS's lawyer. And so she did that. She went to Hamlin Law School, and then she did so well that half of her tuition was paid through scholarships, because she's just that bright. And I'm telling you, that's no BS. She is one of the brightest people I know. And then, so here's, I can't see this. We've got it so far out. There's Sydney. Now look at how big she is. That's crazy. And Cameo Chad, they love, is it Charlotte? Charlotte's. They have a big farm out in Stanchfield. And they have this fantastic farm out there, which I'm still waiting for the invite, but that's okay. Her husband Chad, if you guys didn't see, he's sitting right next to them. And then Sydney. And then back in 2011, they adopted Natalia from Russia. And I don't, how, 4? 5? 4? She's 5. 5 years old now. So, fantastic family. So, Cameo, this is Cameo and her family. Dad, Sydney, Natalia, Cameo. I'm sorry, you guys. That was the only one I could. So, and then in 2012, Cameo graduated from law school at Hamlin, and then she became our in-house. That was the day I was completely humiliated, so it's okay. So, and then as our general counsel, she's in charge of our regulatory affairs still. The legal and government relations, her and Bill Amber, and Susan is very involved with that, as a few of the other folks in the organization. She's over the customer service department and the IT department as well. So, seriously, this quote that I put on here is absolutely true. We could not be in the place right now if it weren't for Cameo Zender. She has given her last 20 years of incredible dedicated service, commitment. Sorry, Chad, Sydney, and Natalia, for time that we have taken away from you guys. It's because she is so dedicated to this organization. I can't thank her enough for the 20 years, and I'm just looking forward to another 20. So with that, Cameo. So I won't make you come up, Cameo, but we do have a little something for you. It came in a cream barrel, they box it up so nice. Cameo's a huge popcorn gal. I know it's like, ooh, popcorn, great, 20 years popcorn. There's a little something else in there for you. And then Cameo loves M&Ms in her popcorn. And Natalia, you probably do too, huh? Yes. You want to carry that? That's pretty heavy. No. And then there's another bag.
Oh, good.
You want to carry that, Natalia?
You can do that one. Well, here, thank you.
Thank you. Thank you.
My apologies, because through the storytelling, you now know why we have a dress code policy and a new product request policy.
Thank you.
Well, Cameo, I think you should consider yourself lucky for those pictures. And we had many more. There was one more. And you didn't have one with a cigar stuck up your nose. All right, so we actually have some more anniversaries to celebrate, some pretty big ones. 2 10-year anniversaries. So first up is Mike Vogel.
So we're going to do Jenny's 10-year today. Yes, get up there. We'll just embarrass her with the earlier pictures instead. So down there, in kind of looks like a little bit like Braveheart, but that's actually Bon Jovi there. She was a Bon Jovi fanatic. So we thought we'd let her relive her glory years here, and I got her a Bon Jovi CD so she could run it. What's the CD? You have to be a Bon Jovi fan. So obviously family is very important to Jen. All right, so her kids there are Matthew standing up, and Cassie and Jared, and then Dylan, her mom and dad, her siblings. Who's that guy? Zane. I don't want to give it all away. So some things you might not know about Jen are she's the food pump queen in Biomed. She takes care of a lot of food pumps for us. So since she's the food pump queen, I thought I'd get her a gift for some real food. And Eddington, she likes to go there, so I got her a little gift card to Eddington's. And she's related to 3 people at PHS, if you didn't know. The first one being her brother John, her sister Darcy, and her husband Dane.
Related to you?
No. She's also a part-time massage therapist. You might not have known that about her. She also loves to discuss conspiracy theories. Remember back in Biomed, Jen loves conspiracy theories, so I thought I'd get her a little book here. It's called 100 Things You're Not Supposed to Know. So, brush up on them for you there. And I had to find some way to put this in. I'm sorry. She is a master of many facial expressions, as you can see here. So. Again, thank you for your time.
And next up, I think we got a first-time presenter, right? Okay. Oh, you got it. Okay. Jamie's up next. So, Lori.
Happy 10-year, Lori. I can't believe it's been 10 years. I've only been here a year and a half, so. So Pam probably has a lot better stories than I do, so we'll spare her any embarrassment. But I did dig up some pictures, just some random office photos, sharing some cake there for our cookie with Susan and bowling event. Some family and friend photos. That's her husband Josh and son Cody. You can see in the middle there how much he's grown. What is the age difference, or what is the number of years difference in those photos there? It looks like he grew about 2 feet. Yeah.
Maybe.
Yeah. 6 months.
Yeah.
Some of you might not know that she's a fitness guru. Actually, master trainer is her official title. So there's some action shots. And then some sort of post-apocalyptic hellscape. She seems to be enjoying who is now 60 pounds. So they grow up fast. They do become dogs. So yeah, just some of Lori's financial responsibilities, financial statement prep, analysis, journal entries, bank deposits, cash monitoring, fixed asset tracking, accounts payable backup, and much, much more. So congrats on 10 years. Hopefully you'll have another 10.
So really perfect timing for this next topic, because as you know, August is the first month of our fiscal year.
How much vodka you got?
I haven't even started drinking yet. Okay, October is our first month of the fiscal year. We've been working pretty hard finalizing budget and strategic plan. So Joe, who is our new director of business development and strategic planning, is going to present this next topic. So Joe, you're up.
Thank you. So I don't know if the 10-year, 20-year roasts are motivation to stick around, or if it's to get people to flee. So we have been hard at work. I think it's extremely appropriate that we focus on customer service when we're talking about this. Growth has been a theme within Pediatric Home Services history, and we grow because of our customer service. So it's really easy to go out and market and sell and talk to providers about pediatric home service when you have a fantastic customer service backing you, and the reputation of taking care of the child and being out there really doing everything that we can to take care of the folks that we serve. So keep that up. It's Customer Service Month. I'm glad that, or is it a week or a month? Is it just a week?
It should be a month.
We'll go for the month. But it's extremely appropriate that we're celebrating that group, and everybody, do your word search and all that stuff. I'm going to take a couple of minutes. I think I have about 7.3 minutes to talk through this, to talk about the 2015 plan. As Todd mentioned, we've been hard at work at this for a couple of months now, actually. We started back in June with all the different departments building up their plans for 2015 and their budgets. And then the senior team got together and really focused in on first our 5-year look forward, and then came back and said, okay, if we're going to get where we want to be in 5 years, what do we have to do next year? And we started to really zero in on what are our priorities for 2015 and what are our goals for this year. So we'll talk about that here. When we start with, oops, wrong button. When we start with building the plan, we're always grounded in the vision and the mission. We've hit it a bunch of times today. So taking care of the child, taking care of the child, taking care of the child. So everything is focused on reaffirming that vision and mission and making sure that we're building to support that, and that all of our goals align with it. Once we kind of reaffirm that we're still going for that vision and mission. We zero in on what our goals are for the next year, and then we build strategies to achieve those goals that we put forward. What is our vision and mission? I'm not going to drain this slide. It would be great if we could just do in unison a recitation of this, but it's taking care of the child. We did spend a little bit of time on the mission and added a few bullets to our mission. This was really just to kind of reinforce some of the things that we already know, but added that we're a pediatric-focused company, ethically sound company, and an innovative company. So a lot of the things that we've done over the years really are evidence of these attributes, but we wanted to call them out specifically in our mission statement. So after we reaffirmed the vision and the mission, we zeroed in on our goals. And really, the big categories of our goals are the same as fiscal year 14. So we focused in on people, financial, customer and external goals, and operations and internal goals. We'll get into each one of these bullets over the next couple of slides, but we reaffirmed that what we were focused on in 14 is consistent with what we need to focus on in 15. The strategies to get to those goals are a little bit different than they were last year. So if we focus on the people first, developing future leadership, we have a succession plan in place for clinical services and operations, and we need to execute on it. So we have some key retirements over the next couple of years. We've talked about them in this forum over the last couple of months, and we have plans in place to make sure that we're stable and we're able to learn from the folks that are leaving us and be able to continue on with building the skills that they're taking with them. So executing on the succession plan that we have in place for those two groups, building leadership skills within PHS through the development of a corporate training and leadership development program. We're working on an acronym for that one, but we'll have Todd's going to focus a lot of time on this, but really focusing on how are we building our people and making sure that everybody is able to build their skills within PHS to rise as high as they want to within the organization. And then creating a succession plan view for all departments. So we've really focused on clinical and operations, but it's important that we have bench strength behind our key folks in all of the departments. So broadening that out, identifying what those key roles are and who's next up, if you will, as far as the key folks within our organization. Improve employee work experience. So two big ones here, again, the Bloody Marys. Foster and communicate the importance of living the mission of PHS. So we have a bunch of ideas on how to emphasize this, but really, as we get bigger and everybody, it's hard for people to fit in this room to really communicate this, but just making sure that we're re-emphasizing in everything that we do what the vision and mission of PHS is. Today you saw a note from the corner office. I can't remember exactly what we landed on. Comments from the corner office. A note from Mark starting to communicate some of those things, but you'll see that throughout the year, really being intentional on how we're communicating the mission and the vision of PHS. And then focusing on our physical structure. You guys may notice that you're getting a little bit closer to your neighbor here and there, but we're growing and the building isn't growing. So we really need to be intentional in the way that we're thinking about our physical space and managing that, making sure that we're taking into consideration where people are and what's important as far as the space is concerned, and thinking far into the future about where we'll be and what we need to do in order to accommodate the growth that we've seen and will see over the years. Now, financial targets. This is a busy slide. I was given the 5-minute signal a moment ago, so I'm going to go pretty quickly through it. But we have growth targets for the year. And why we have them, we don't just drum these up out of nowhere, but I wanted to spend just a second kind of talking about how we come to our financial targets for the year. So we just closed the books on last year yesterday, and we had 17% growth. That is phenomenal, people. We had a great year last year. And we are aiming a little bit lower for next year, but realistic target of 10.3% for the entire company growth. Where do we come up with that? We don't kind of just say 10.3, but we build it up from each one of the service lines within PHS. So our RT department, we're aiming for a 10.9%, right around 11% growth. That group really kind of goes with the economy, and it's built on trends for the overall population. So I anticipate a strong economy. There isn't much of an indication that it's going to slow down. We've seen growth in Rochester. That growth is going to continue to bear fruit throughout the next year, and we expect it to continue throughout 2015. And then as our hospital partners change their models, we need to evolve with them. We anticipate that there will probably be some product additions in order to accommodate their needs. IV, we have projected a 9.4% growth. This one's close to our actual growth, but short of our target for 2014. We've seen a lot of increasing competition from hospital-owned groups. We've seen our enzyme replacement therapy, which is a really big revenue part of our IV, fluctuate. It's unpredictable, and we think that we'll be right around 9.4% with a focus on sales and increased competition from the hospital-owned groups, so potentially losing a little bit of business there or not being able to grow as quickly. From HCN standpoint, a steady increase in patient count. We've got a goal of a 9.2% growth. That's really just based on a target of additional patients throughout the year and growing at a steady pace to be able to accommodate the work. The real all-star here is Monica's going to grow 228%. So we have a target to really fill up our play therapy, our behavioral health practice. Developing new business, so we will continue to focus on new business opportunities. We've talked about feeding clinic therapy opportunities. We're going to determine whether to enter complex rehab. We're really going to focus on our external relationship building, kind of beyond just the sales and marketing department, but start to focus on our major relationships and really understand where our key touch points are there and be intentional as far as building those relationships. And then we're going to think about Medicare certification and determine whether or not that should be pursued. So from a new business standpoint, those are a few of the areas that we'll be focusing in. Improve customer experience. We talked a lot about this today, but we've got some big ones. Implement online ordering. We've talked about that in here quite a bit. And then focus on our onboarding process for patients. So we've called this the hub and spoke effort. A lot of people in the room have been involved in work. I think it was earlier today or yesterday we met on this and have a decent amount of work underway. But an opportunity to really understand efficiencies for how to serve our customers and providers and make sure that we're doing it as efficiently as possible. And then legislative matters. So we have two big goals. We will definitely spend more time in this forum talking about our legislative goals, but we are aiming to establish a tier of home care nursing that appropriately reflects the care necessary for children with medical complexities. So this is a similar goal to what we had last year in the legislative session, but continuing to pursue that and push it with our contacts in St. Paul. And then keeping competitive bidding out of Minnesota Medical Assistance. I think actually you probably flip those as far as priority is concerned, but competitive bidding is in Medicare right now. It's a pricing structure that we don't necessarily want to see within Minnesota MA, and we're working to avoid the implementation of that. So, so what? Oh, I didn't get to I've got one more slide. Perpetual inventory management. So what does this mean? This means keeping track of what's on our shelves at all times. So being able to implement technology to really have ongoing accurate inventory of our products that are in the warehouse. So implementing that in 2015. And then implementing ICD-10. So we thought we were going to implement ICD-10 right about now, but the federal government pushed it off. It's a code set that we use for billing services. It's planned for 2015. So in 2015, we have a goal of being ready for implementation of ICD-10. So what? So what does that mean to you? All of these goals do reflect, or the achievement of these goals do reflect the work that everybody in this room does. So everything that you do rolls up to the achievement of the overall business goals. So every day that you're on the phone, every day that you're in the field, every day that you're walking the halls of the hospital, what you do really does push for the achievement of the goals that we've laid out. I really encourage everybody to talk to your manager about how what you do ties directly to these goals and really think about how your job relates. Now, let's go take care of the kids. Let's go. Yeah.
Just to break up things here a little bit, we have a special performance next. Josh and Melanie are going to be singing a duet. But they're up next talking about regulatory agencies.
I don't know about you, Mel, but you definitely don't want to hear me sing.
No, me neither. I don't even like hearing it.
All right, so, wow, this is a tough act to follow because we've had some great anniversaries, we had some really good information about the future of PHS, and now we're going to do the educational piece, regulatory agencies. However, as Joe was talking, I was thinking, a lot of this really does tie into our mission. As you saw, one of the bullets on our mission is to provide services that are ethically and morally correct. That really ties right back to regulatory agencies. Regulatory agencies are all about making sure we're following the rules, following the laws. So with that said, I'm going to throw up some cute little pictures because we're multitasking this morning, or this afternoon. We are going to include some pictures of last year's holiday party to kind of put you guys in the mood. I think it's just, 2 weeks away, 3 weeks away? It's coming up pretty soon. So
2.5.
I couldn't find any cute pictures of regulatory agencies out there, so I thought this might work. All right, so we're going to see how much you guys have been paying attention to some of our conversations in the past. Maybe? All right, so when we talk about regulatory agencies, there's a lot of alphabet soup. There's a lot of acronyms, as I talked to earlier. A lot of acronyms out there. So Melania and I are going to throw some acronyms on the screen. I'd like you to raise your hand, and whoever can come up with the name of the acronym will win a cute little prize. So we'll start.
Oh, Mark, that was
Mark?
Minnesota Department of Health.
Minnesota Department of Health. Very good.
Oh, I'm throwing
Yeah.
in today.
Louder so we can hear.
I am.
All right, the next one.
So this one's harder. Yes, Mark, what do you think FSA is?
Flexible spending account.
No. But it is.
What's that?
No. But that's very
Good guess.
Good
Good guess.
Linda?
Federal Safety Administration?
Yeah. So this one is really, really hard. This is something from the next one coming up soon. It's something that we do for Joint Commission. So it's our Focus Standards Assessment. It's an annual assessment that I have to do every year. I'm teaching you guys, right? So every year that they don't come in for their survey, I have to go through the whole Bible, I like to call it, Joint Commission Bible, and make sure that we're meeting all the standards that they set in place. And if we're not meeting it, work on how can we get so that we are meeting it when they come very soon.
The next one's easier.
Yeah, you gave me the hard ones.
OIG. Pam.
Office of Inspector General.
Exactly. Good job.
I don't know. Are you ready?
So,
Should I want to throw
so talk about OIG before. I liken them to the FBI. We don't want to see them at our first job. They wear the blue jackets with the yellow lettering. Not good. Not good. So every department in the federal government has an OIG division, and they're responsible for investigating concerns or complaints about fraud and abuse. So specifically, the Department of Health and Human Services has an OIG department that investigates healthcare fraud and abuse. Because we are a Medicare provider, we would fall under their purview. So Medicaid. Thank you. I was focused on Medicare certification.
All right, TPC.
The next one.
Mark.
I'll give it to Mike.
Okay.
The Joint Commission.
Yeah.
Maybe she wants
That's just bad throat.
All right, everybody knows what the Joint Commission is, correct?
Well, if you don't, you'll be learning a lot more over the next so many months. They should be coming sometime, probably summer 2015. So I've already started getting invites to different department meetings, and I'll be kind of going over what the standards are and how it relates to your department a little bit more. So a lot more to come.
They could come tomorrow.
The next
Technically, they
one.
could.
Oh, jump forward a little bit. OCR. Going once.
Character recognition.
Office of Civil Rights.
You what? Oh, there you go, Sherry.
Nice, nice.
A little off.
All right, the Office of Civil Rights, exactly. So that's the department that is responsible for investigating concerns about HIPAA abuse, HIPAA violations. And we'll talk more about that in a little bit. So the next one, MOS.
Josh gives me the hard ones for you guys, so, what? It has something to do with just the Joint Commission. Cameo?
Can't say that word. Measure of success.
Yes. All right, ready? Oh, yours lights up too.
Too much vodka?
Cameo, do you have your? Yeah, I'm not gonna throw away your stuff.
Come on.
I'm off today. Okay, so measurement of success is a Joint Commission thing. So mainly what that means is if there's a standard that we're not meeting, when Joint Commission is here, we get so many days to show how we are in compliance, and some of these standards require measurements of success, so doing an audit on it is usually like the biggest one in trend, how we are then meeting the standard.
All right. The next one.
Food and Drug Administration.
Perfect.
Obviously, little
All right. And then the last one. HIPAA.
Oh, Mike, yes.
Mike.
Health Insurance Protective and Accessibility Act.
What was it? You got it. Perfect. Perfect. So you were paying attention this morning.
I already warned the new nurses coming in that we're going to have to hear this twice from us today, so good job.
All right. Let everybody soak this up for a minute. I love this slide because it's a great illustration of why communication is so important, especially in healthcare where errors can lead to patient harm and potentially even patient death. So obviously it's a big deal. So there are some federal guidelines and standards for health literacy and cultural competency. One of the standards is CLASS. CLASS stands for Culturally and Linguistically Appropriate Services. These are a set of standards that really provide direction for healthcare organizations for equitable, respectful, understandable services and care that are responsive to a diverse healthcare population. Specifically speaking to healthcare beliefs, preferred languages, health literacy, and different communication needs of our patient population. In addition, the Joint Commission actually does have a standard in their book, in their Bible as Melanie calls it, that specifically speaks to patient-centered communication. It's focused on hospitals, but where hospitals usually go, home care will follow. So you never know, the Joint Commission might have standards specifically for home care at some point in time. All right, the Title VI Act of the Civil Rights Act really speaks specifically to language access for LEP patients. So we have an obligation to provide information in a manner that our families can understand, especially patients who have limited English proficiencies. So one of the ways that we do that is we provide interpreter services and we translate our material. All of our material, education material, goes through plain language review. It's not because we have nothing better to do, but it's truly because we want to provide information in a manner that families can understand. And Kathleen, I'm going to put you on the spot. What is the grade level right now for plain language review, roughly?
Oh, 5th grade, but that's just a small portion of the review.
Roughly 5th grade. Mm-hmm. All right. The American with Disabilities Act is another act that we have to be cognizant of. That really speaks to preventing discrimination by places of public accommodation. So specifically, that speaks to our patient population who may be deaf or who may be blind. Again, we can provide sign language for those patient populations who don't inadvertently discriminate against those patients. All right, pause. Some more pictures.
All right. So, we'll talk about Joint Commission next. We only really have one slide on this because, like I said earlier, I'll be coming to your department soon and talking to you more about it. But mainly, we chose Joint Commission to be accredited through because their mission aligns really close with ours, which is safe, quality care. We're accredited. We chose to be back in 1994, and we have been since then, and mainly because it's kind of that gold seal of approval for healthcare companies when you have, when you're accredited. And then Joint Commission, we chose them, once again, that gold seal of approval, and mainly because it's the one that everyone knows. There's like 4 other agencies out there. Please don't ask me the names of them because I don't know, but Joint Commission is just the most recognized. So. We'll jump to Food and Drug Administration next. I get multiple emails throughout the day from the FDA when there's medication recalls, food recalls. You guys have probably seen on Thrive-In. I have posted a few things when different products that you might buy in the grocery store become recalled or safety alerts. Mainly what we do with those is when anything that affects PHS, any medications, any equipment that we have is going to be recalled or there's a safety alert with it, I alert that department. I work really close with Jill for a lot of our medications ones, and we come up with a plan. What do we have to do? Are we affected? And if we are, do we have to get it out of the home? Do we tell them to throw it away at the home? What do we do? And then we come up with a game plan for that. So, MedWatch reports are another big thing that's through the FDA as well. So if a ventilator does not alarm when it was supposed to alarm, to alert the caregiver something's wrong, if we're alerted to that, we need to send a MedWatch report into the FDA to let them know there's a piece of equipment, life support equipment, that didn't function the way it was supposed to. That's concerning. And then what they do is they trend it, and sometimes that's where they come out, actually a lot of times is where they come with, they decide to recall a whole product line potentially because of the complaints. So. All right, so the Minnesota State licensure, we're going to spend a little bit more time on this only because there was a big change this year. For the clinical staff, sorry, I know you sat through a lot of this, but just to let everyone else know, we no longer have a Class A licensure. As of September 23rd, we are now a comprehensive licensure. So what the state decided to do was instead of having 4 different classes, they kind of wiped all that away, and now there's 2 classes. So your first one is going to be your basic home care licensure, and those are for like your home health aid services, your PCA services. There's a lot of home care companies out there who do just that, so they would just have to apply for the basic licensure. Everyone else kind of falls under that comprehensive licensure. As you know, we have licensed clinicians out there doing a great job, so we had to get the comprehensive licensure. It just kind of incorporates everything else. If in the future, not that we're talking about it, but if we ever decide to look at PCA or home health aid services, our comprehensive licensure would cover that. We wouldn't have to get a basic licensure on top of that. So, why were there changes? Some of them, the frequency of surveys. So, I think there's one that's all left. Does anybody know when PHS had the last survey? Oh, Mark.
2006.
Yeah.
Yes.
Nice.
You won.
So, frequency of surveys, they are saying definitely by 2016 they are going to be doing every 3-year surveys. Their surveys won't be quite as long as Joint Commission's, there's about a day, but they're going to promise they're doing more frequently. Surveyor training requirements, so the nice thing now going from 4 licensures to 2, it's easier to remember the differences between the 2. So, the new process for imposing fines is kind of, they are going to impose them based on the scope and severity of the violation. The increase in fees. And then medication management clarifications. So when we did this talk to the clinical group, we said they are adding some things to medication management. One of the other things they're looking at is saying we potentially might not need a prescription for over-the-counter drugs. We haven't made any decision on that yet. We're still looking at it and evaluating it, but that's kind of nice for our home care nurses. So, and then quality management plan. Basically that just says every company, healthcare company, home care company needs to have this plan. PHS already does this though. We have QIC, CQIPs, things like that.
Pay groups.
Pay groups, sorry. So key dates. January 1st of this year is when any new company opening up had to apply for the new licensure. Like I said before, it was September 23rd. We have our comprehensive licensure. It's already hung up front, if anyone wants to look at it, at the front desk. And then by June 30th of 2016, the state says everybody should be under this and surveys should be done. Josh and I have kind of a bet that we don't want to shake hands, but we're pretty sure they'll probably be here in the next year. So,
With Joint Commission.
please no.
Bring it up.
So you guys, I'll just kind of go through this pretty quick, but the on-site survey process is pretty similar to how Joint Commission is going to be. They come in, we sit down with them and come up with a plan. They do a lot of communication with different department heads, and then what they do is they get a tour and they come up with who are they going to go out and see. So that's where we select the client, and then they actually go out to a home usually, and they'll do interviews with the clinician who's with them as well as the family members. And then they do an on-site exit conference. So this will cover any preliminary findings they might find and just talk a little bit about how well we did. If anyone's interested, there is an MFiles document on how to respond to the comprehensive licensure. So. And pause again for a few pictures.
All right. So I got the card, so I'm going to really speed through these next couple of slides. So Minnesota Home Care Bill rates. Pop question, how do we provide our Minnesota Home Care Bill rates to our patients? You've got it, our care and service booklet. Every single patient gets a care and service booklet. Every single patient gets a copy of the Minnesota Home Care Bill rates. In addition, part of training under the comprehensive licensure, we need to review the Minnesota Home Care Bill rates with you folks every year. And that's what we're doing right now. So there are some very important Minnesota Home Care Bill rates that I put up here on the board. There's all in total, there's 22 of them. We're going to briefly look at 10 of them. Obviously, our patients have a right to receive care and services according to an updated care plan. They have a right to refuse service and treatment. They can say no. They have that right. They have a right to know before receiving services any limits to the services we can provide. One of the ways that we do that is for our high-tech patients, our HCN patients, our IV patients, our dietitian patients, we enter into a service agreement. So we go over the services that they will be receiving. All of our patients have a right to choose freely among providers. When patients are set up in the hospitals, they're often given a chance of which company would you want to go with. Now again, we have exceptional customer service, so why would they go anywhere else? But they have that option. They have a right to access their medical records. They have a right to be served by people who are competent and trained, which is, again, another reason why we put so much emphasis into our training here at PHS. This one goes without saying. Next one's also quite common sense. They have a right to be free from physical, verbal abuse, neglect, as all covered under the Vulnerable Adults Act and the Maltreatment Act of Minnesota. They have a right to 10 days notice if we choose to terminate service. That's to allow that individual, that patient, to find another provider. Obviously, we don't want patients to be left high and dry. And they have a right to complain about services. We do have a complaint process at PHS. All right, moving on to the service plan and agreement. This, as I mentioned earlier, we used to call it the service agreement, but as of the comprehensive licensure change, the state changed their terminology. So the service agreement is no longer, it is now called the service plan. Small tweak in terminology, but it really aligns the Department of Health and Human Services and MDH, so they're using similar language. DHS has a service agreement. I know some of the prior auth folks have seen it before. MDH is now using terminology service plan. And that really is a requirement for all providers who maintain a service with the patient. So it serves as our informed consent. It's a Joint Commission requirement. It also allows us to effectively communicate with the patient and give them an understanding of the services that we're providing, and how much we're charging for that service, the frequency of that service. And also a statement of services authorized. Yep. So that really is a service plan in a nutshell. I know we've covered it with the clinical team already, so I'm not going to belabor this. I know we're running over on time. This is an example of the service plan. This is the front. The clinicians fill this out when they set up a patient. And then there's a copy of the back of the service plan with detailed descriptions, yada, yada, yada. All right, more pictures.
All right, so to wrap up really quick, because we're almost done. So really quick, we wanted to go over orientation requirements. Everyone, all employees have to go through it, and these are just some of the content. So sometimes you wonder why so many staff meetings, why do we do what we do, and it's usually a state and a joint commission requirement. So emergencies, PHS policies, procedures, client complaints are a few. So see, wasn't really that scary. It's so cute. So.
Thank you, guys.
All right, so the rest of our staff meeting will be an exercise in either speed reading or speed listening, because we are running behind. Next up, we have Dr. Maynard, who's going to give us a public service announcement about influenza. So put you on the spot, Dr. Maynard.
Yeah, I'll go. I'll try
1 minute.
Winter's coming. Where's this from? You're gonna have to wait till March of next year. So this is smallpox. In its severest form, this would rival Ebola for case fatality rate. That's the percentage of people who die who contract the disease. How many people know that the guy in Texas died today? 30% of the people in the severe form would die, which is probably what Ebola was. The mortality for children was very high. In the 18th century, 400,000 people died. Which one's the real Dr. Edward Jenner? One on the left's getting a divorce. So Dr. Jenner figured out that the gals who were milkmaids milking the cows never got smallpox and never died. They didn't die because they were getting contaminated with cowpox, which is very similar to smallpox. And he figured out that if you inoculate human beings with cowpox, they were immunized and didn't get smallpox. That's why we have immunizations today, and smallpox has been eradicated. Influenza is not just a simple cold. We did a survey 2 years ago in 2012 to look and see why people don't get the vaccine. We had 39 respondents, makes me sick. Well, here's the truth. 15 to 20% of people can get a local reaction to the injection, but less than 1% will have a systemic fever or illness from it. And when I ran the studies with Synagis, I can tell you that the local reactions in the kids who got saline injections was no different than the kids who got the Synagis injections. So it's not from the vaccine necessarily. It used to be a contraindication if you're allergic to eggs. It's not anymore because the vaccine is so purified now that there's very, very just almost infinitesimal absence of any egg protein in it. I don't believe the vaccine is safe. From 1990 to 2005, there are only 4 deaths that could be attributed to influenza. Further epidemiological studies have also shown that Guillain-Barré syndrome, which is an ascending form of paralysis, which people have noted that can be associated with influenza vaccine, but your chances are much greater of getting that if you actually get the natural virus in the real world. Influenza causes Guillain-Barré syndrome. I've gotten the vaccine before and I still got influenza. The people who make these vaccines do the best job they can to pick or predict what the shift is going to be in the virus and pick the best strains to immunize you with. You know, they don't have a crystal ball. They're not always perfect. You have to have the shot for at least 2 weeks before your body has enough immunity to fight off the virus. And for some people, it just doesn't work. We know that. I'm so healthy, I don't need it. That's because a lot of the people around you got immunized and you were lucky you didn't get exposed to it. Never got flu before, why worry? No concrete link to the research. 3,000 to 49,000 deaths per year. Last year in the United States, there were 30,000 deaths attributed to influenza. Only 46% of Americans got flu shots last year. Healthy people get the flu. Healthy people die from the flu. In the pandemic with the H1N1 virus in 2009, it was mostly adults under age 65 who got really sick with the virus and died. There were 46 deaths in 2005 to 2006, 282 deaths from H1N1. Last year, 100 children died. 90% of those kids were not immunized, and 50% of them were normal kids. They had no underlying chronic disease. Their deaths could have been potentially prevented if they had been immunized. The American Academy of Pediatrics recommends everybody over age 6 months get immunized. We have a young population of gals here. Those of you who are pregnant or planning to get pregnant, you need to be immunized while you're pregnant because babies cannot be immunized until they're 6 months of age. If the mothers get immunized, you pass your antibody through, you protect your baby for those first few months of life. The big change this year, current recommendations this year, is that the flu mist, the nasal spray vaccine, which is a live attenuated vaccine, is now approved for healthy children between age 2 and 8. And in fact, may protect them better against influenza than the flu shot itself. Across the board, the vaccine's about 60% protective. The younger you are, probably the better. The older you are, it may not be better. They have a super vaccine for us old people. I want to assure you the vaccine is safe, it's just not always effective. But even the people who get the vaccine, even if you get influenza, you're probably not going to get as sick as if you didn't get the vaccine. 25 deaths are prevented per 100,000 people vaccinated. These are all statistics you can look up. 1 death prevented for every 4,000 people vaccinated. Protect yourself, protect your family, protect your coworkers, protect your patients. And remember, you know, as a pediatrician, I can assure you that nothing has been done to promote the health and welfare of children in the past century than massive immunization programs for children. It has saved hundreds and thousands of lives of children by having these immunization programs. Thank you.
Makes you wonder, what do you think Dr. Meadard recommends? Get a flu shot. All right, we're going to skip a couple of things. Next month, you can anxiously await a riveting presentation about the security system by none other than Steve Roberts.
It will be riveting.
It will be riveting. So we got time for a graduation. So will the LDP team come on up?
Yep. Anna's sitting over there, so she's doing a shout out from the corner. And Mark had to leave. You wanna come up? So we had another class graduate, you guys. So this is. I think we have like at least 7 people who applied for this next upcoming class. So it's still a lot of interest, and it's a great program. And so, are they the leading link? No. Forgot.
Oh, Lord.
The team name?
007.
007.
Right.
That's right. So we have 3 people who graduated. If they're here, Beth Breisdorf. Sherry Nelson. And Aubrey Bacon.
Thank you, guys.
Thank you. One of the things we learned in the LDP program is communication, public communications. And so if we have each of the 3 stand up, we'll have you do a little Mark
already tried that.
Yeah. Oh, you did? Okay. And that's it. It's a wrap. That's right. Yeah.